Hi, I'm Dr. Allison
Hi,
Rogers,
Dr. Lucky Seacon at RMA of New York.
and I'm at FCI Fertility Centers of Illinois, and we are both fertility doctors, and we happen to also be friends in real life. We are at a conference this week learning, and there's like a streak in your
My
face.
aura. It's my
What the heck is that?
aura.
What
Here,
is
I'll
that?
hold it. There we go.
Oh my God, that's so much better. Oh my God. I'm going to just hold it.
Yes, I got it.
Should we,
I have long arms.
should we restart it?
No, I think it's okay. So, anyway, we're in San Diego at a conference together, and we are really loving, enjoying, and sharing, and collaborating. We've done a live together before, and so we thought we'd answer some questions.
Yes. We were going to start off by talking about what to expect at your first visit, because this can be really overwhelming, a bit scary, and you're not sure what you're walking into.
Yes, and we wanted to illustrate that no matter which doctor you're seeing, whichever clinic you're going to, there's kind of a formula. And I think that it does help for patients to understand what to expect and to know what they're getting into going into it.
Yeah. And so Lucky practices in New York, and I practice in Chicago. Obviously, two different areas, both large cities, but I do think we probably do things pretty similar. And so you can tell me if you do things different.
Yep.
But I usually will get a full history of the patient, and if they have a partner, the partner, and really understand where their fertility journey has been up to this point, if they've done any treatment, any medical issues or medications that could be interfering with their ability to get pregnant or stay pregnant or have a safe pregnancy. And that's sort of the first part, is me getting more information about who they are.
Yeah. And I also delve very deep into family history, things that may not seem relevant to a patient that actually matter a lot. Like, did your mom go into menopause early? Is there a strong family history of certain types of cancers that maybe you should consider being tested for certain gene mutations? So things like that. And then after that, we usually do a physical exam. And a big part of that for us, for our patients, is doing a transvaginal ultrasound to look at the ovaries.
Do you do that on the first appointment?
I usually do.
So that is something different. So we wait until patients are on their period, and we do it with the start of the period. So that doesn't usually line up with that first appointment. So that's interesting.
Yeah.
I mean, we do that same thing, just not quite at that visit.
Yeah. No, so that's a major difference. And then afterwards, we typically will do some blood work, and maybe it won't be the day 3 labs because they'll be at the wrong part of their cycle. But if you're on birth control, sometimes it doesn't matter. But we, generally speaking, will check things like an AMH, check your ovarian and your pituitary hormones, so estrogen, progesterone, LH, FSH, sometimes thyroid function, and other hormones if it makes sense given your history.
So we also offer genetic carrier screening, infectious diseases. We check for rubella and varicella titers, and all of a sudden we've started doing measles now that the recommendation is to do measles.
Yes.
So this is a new recommendation because of the measles outbreak. There's a lot of people that are not immune. So we order all of that testing along with imaging of the inside of the uterus. So usually we'll do a 3-dimensional saline ultrasound, although sometimes we'll do an HSG or hysterosalpingogram, which is an x-ray of the fallopian tubes. Is that what you guys do too?
Yep. And then we'll also give the partners information about how to set up their semen analysis appointment. That's generally not something we like to spring on people.
Oh, great. Yes, I do think that a lot of male partners show up to that first visit assuming that I'm going to be like, here's a cup, go produce a sample, but that is not what happens.
Exactly.
I will also say that most practices are comfortable, especially now after the pandemic, with people collecting samples at home and bringing it in.
Yes.
So that is, most people prefer to collect in the privacy of their home. We do have collection rooms, but I think most patients prefer to collect at home.
That's another reel for another day.
Or maybe later today.
Exactly. But and then after all of that, we figure out a plan in terms of when it makes sense to have a follow-up, to discuss all the results and discuss your timeline for treatment. You might have a chance to meet with other team members, like a coordinator, people from finance, to understand your insurance benefits. And so that way you're getting kind of a 360 view of the entire process.
Yeah, I think that it's pretty hard to try to 100% have that conversation of what treatment you want. I mean, some situations you do, but if you're screening for a genetic disorder, something like that, but sometimes it really depends on the test results and what we get back. So typically we meet, order testing, get the testing done, and then meet back to review all the test results so that we can be very strategic in figuring out what best option is for you.
And what do you think are some important questions people should ask at that first visit?
That's a good question. I think understanding how do you contact someone, like how do I set up an appointment? How do I contact my clinical team, which is certainly different than the administrative team that sets up appointments, right? And like, how do I contact you, doctor, if I need to ask a question?
Is it through a portal? Is it through an email?
Right. Yeah. So I think those are all things. I think you and I probably are, we've already talked about the fact that we're like very similar. Yeah. We're like sisters from a different mister. Like we are kind of very similar in the way we practice. We like to really provide individualized care. And that's something that's important to both of us. So I think, you know, not all doctors have that sort of, I think a lot of doctors do, but not all doctors want to be so involved personally. Like, I don't know.
With communication, like sometimes it's something that's shared by the team, but I think we're control freaks. There's no better way to put it.
It's true. I call it being thorough.
Yeah, exactly.
Some people might say,
but I think that's a really,
but I say thorough.
That's a really good question, though.
Yeah.
And I think other questions to ask are, and maybe this is getting too in the weeds, but you know, different clinics have different approaches. So understanding like high level things like, do they typically, freeze all the embryos and do transfers in a frozen cycle, or do they transfer embryos at day 3 or day 5? If you're doing PGT testing on embryos, do they report out everything, including if you have a mosaic embryo? And maybe, again, this is getting too in the weeds, but I think those are like high-level things that differentiate different clinics.
And I also will say there are some clinics out there who the way that the practice is set up is that sort of the doctor